Hi, today is October 5th, 2021, and I'm going to give you an update on Covid-19 treatment. And take this topic because a few days ago, Merck really gave very exciting data and showed that the drug molnupiravir is very effective against this virus. And interim analysis of data from a randomized trial found that it cut the risk of hospitalization by about 50%. And of 385 patients who took molnupiravir, 28 or 7.3% was hospitalized, and compared with 53 out of 377, this is 14.1%, who got the placebo, and that means just sugar pill. What is more important is that no death was reported in patients who got this molnupiravir, but 8 died in the placebo group. That is a huge difference. And when you get results like this, you should stop the clinical trial, because the people who are placebo have the right to get the drug, because this can have potential save life. And this is really one of the exciting field on this treatment of Covid-19. And so, besides molnupiravir, and we have many other drugs for Covid-19. And we really, since beginning of 2020, this really have significant development in the field of Covid-19 treatment. And here I just have summarized the reagent for Covid-19 treatment. We have remdesivir is very close to molnupiravir. It is also antiviral drug. And also the monoclonal antibody is also antibody against spike protein, and it's also kind of a drug which can kill the virus. And that includes 3 different kinds of monoclonal antibodies, which include 2 combinations, which from Regeneron and Eli Lilly, and also have Johnson & Johnson. And we know that Covid-19 patients usually have a cytokine storm, that overexpression of cytokine, and that may result in serious inflammatory reaction. So usually they use steroid. And we also know the patient usually have a clot in the lung, so they also use anticoagulant. And another drug was approved by emergency use is Evactidar. And that we know that the blood vessel in the lungs have a contraction, and Evactidar actually is a kind of relaxed blood vessel in the lung. So this serious drugs can be used for treat Covid-19 infection. And I should point out, this is just for information only. If you suffer from Covid-19 infection, you need to see a doctor and get professional help. Here, this is just for information only. It is clear that the molnupiravir will have some kind change the entire treatment for Covid-19. We know that the antiviral drug remdesivir, as well as monoclonal antibodies, are administered via intravenous infusion. And intravenous infusion is usually done in the hospital or a clinic where infected people risk transmitting the virus to medical staff and other patients. And so the molnupiravir main advantage is that it is taken as a pill. So it enables patients to be treated at home. And because this, they're also not likely that this molnupiravir is cheaper. We know the monoclonal antibody is very, very expensive because it's very expensive to generate monoclonal antibodies. Need a very expensive facility, and so the molnupiravir is likely that much more cheaper than monoclonal antibody. And so it's clear that the molnupiravir will change the landscape of COVID-19 treatment. So, and I should also point out that treatment of COVID-19 cannot replace vaccine. So prevention is always better than the treatment. And because there's so many side effects, and nowadays that is very, because millions of people have infected with the virus, have called this long-haul COVID-19 infection. So if you infect the virus, and people think the virus can maybe stay in the human body for a long time and cause long-term side effect or long-term effect from the virus infection. Again, if you can, please get the vaccination. Prevention is always 100% better than treatment. Of course, because even people get vaccination, there's some kind of breakthrough. So in this case, you have potential to take some of the drug. And drug like molnupiravir will be really, really helpful because it's not only can be used for treatment, looks like that can also be used for prevention. So if you have exposed to people who have infected with COVID-19, and it may be possible for you just take this molnupiravir, which can, because they can and kill the virus to prevent the virus replication. That's why it's not only for treatment, but also can be used to prevent you from get this virus. And this is a really, really exciting field now. And with all these vaccines and drugs, and COVID-19 is really under control. So we hope everyone have a normal life. But that's just for your information. So if you get COVID-19, you should have discussed with your doctor. And there's so many alternatives. And that's just the kind of normal illness. So I guess, and if you have more knowledge, it will be helpful for you. So, and this is not different kind of treatment that's really definitely help you to, even so you get this COVID-19 infection, this chance that you have so many different regimens for you to kill the virus. So that's the video for today. I wish you are happy and healthy. I wish to see you in my next video, and thank you and bye.